Alright, so here's our video for the male and female perineum. This is brought to you by the Scrubs team, which stands for the Student Collaborative Resources for Understanding Inbreeding Success. Going over our mission statement once again, Scrubs is a student-derived initiative that is aiming to develop supplemental resources for current and future cohorts that will pass through Brody, and we participate in a variety of subcommittees working to create resources for students, by students, aiming to offer a perspective from a student who has gone through the course and walked in the same shoes. So we're hoping that this organization will eventually become a staple of the Brody student body and will exemplify the unique collaborative community that Brody offers. Going into a brief disclaimer, as always, these resources are made by students and not by faculty, so there is a possibility for errors, although we do attempt to minimize these as much as possible. If there is a contradiction within the coursework and anything that is presented in this video, please go by your course documents. Additionally, this is a supplemental resource that does not take the instruction away from the Brody faculty. So with that, let's go ahead and dive into some content. So when we're talking about the male and female perineum, we're going to start by talking about the external genitalia for the males and the females. So let's start with the male genitalia. Externally, we are going to have the scrotum located down here inferiorly. The scrotum is composed of the skin plus the superficial perineal fascia, which contains the dartos muscle. So the superficial perineal fascia is continuous with the fascia from the lower abdominal region, and the dartos muscle is a muscle that, when contracted, is going to rise the scrotum. So when you ask someone to cough, that's actually what's bringing the scrotum up more superficially or superiorly. Now, out here we do have the penile structure. The penis is made up of a couple of different components. We'll see on the next slide in a cross section the difference between the corpora cavernosa and the corpus spongiosum. But what I want to point out is there are three tubes that make up the penis. There is one that is made of spongy tissue, which has the urethra running through it. So that is this large structure here. It expands more distally to form the glands of the penis. And again, you can see that the urethra is running through, so this would be the prostatic urethra. Okay, so prostatic urethra, or sorry, spongy urethra running through here. Right, this would be your membranous urethra, and this would be your prostatic urethra. Remember that the urethra in males has three different components. So prostatic, membranous, and then your spongy urethra coming more distally to open up onto the external urethral orifice. Okay, now up here more superiorly in this particular view, you can see one of the other tubes that makes up the penis. This is going to be the corpus cavernosum. I think this is better demonstrated in a cross-sectional view that we'll see in just a moment. Right. Other things, we mentioned the external urethral orifice. The bulb of the penis is located more proximally, so down in this region. And then the prepuce is the, also known as the foreskin, is going to extend over top of the glans penis and is often resected after birth in a circumcision. Now, some other things that this image points out that we can just go through briefly, just going through the labels. We do see the ductus deferens coming from the testes. So here goes the epididymis. The epididymis has a head, a body, and a tail. That goes into the ductus deferens, running more superiorly. And then you'll see that that is actually going to be wrapping around and draining into the prostate after it joins with the seminal gland. When the seminal gland and the ductus deferens come together, that forms the ejaculatory duct. So the ejaculatory duct drains into the prostate to join the prostatic urethra to allow fluids to come down distally, where it'll get the final contribution from the bulbourethral gland, and it'll come through the urethra out as semen. And we'll touch on this again in a little bit later video as well. Over here on the right, you can see just some more in-depth detail of the structure of the testicle. So again, because we're focusing on the external genitalia, this is a cross-section of the penis. You can see that located here. This is something that you will do in lab if you have not done so already. It is important to know a cross-sectional view of the male penis because it is going to clearly show the three tubes that make up the penile structure. So these first tubes on the top, right, this is going to be your corpus cavernosus. So each one of these has cavernous tissue. You can see that there are two of those, and in between, or running through this corpus cavernosum is going to be the deep artery of the penis. This is the actual vessel that is going to vasodilate during erection, and it is going to fill this region full of blood, which is going to allow expansion of the penis. Now down here is the corpus spongiosum. As you can see, it's the most inferior portion of the penile structure. In anatomical position, the penis is erect and up against the abdominal wall, so this would actually be the anterior surface in anatomical position. And then right here we can see that the spongy urethra is passing through the structure. Now when it comes to vasculature that we need to know, mostly up here on the more posterior side in anatomical position of the penis, you're going to have the neurovascular bundles. What we want to point out here is deep, you have the deep dorsal vein, lateral to that is the deep dorsal artery, and most lateral to that is the dorsal nerve of the penis. So going from medial to lateral, you have a vein, artery, and nerve. More superficial to that, you're going to have the superficial dorsal artery of the penis and the superficial dorsal vein of the penis. We'll talk about this again later, but the dorsal nerve of the penis is going to be where you're going to be looking to put a nerve block in for a circumcision. Now, going through some of the other things that you need to know, you do need to know some of these fascial layers. Wrapping around the corpus cavernosa and the corpus spongiosum, you are going to have the tunica albuginea. The albuginea tells you that it is a white fascial layer. When it wraps around these structures, it is also going to be wrapping around the testicle as well. You'll see that later in lab. Other things, next structure that we want to point out is going to be Buck's fascia, also known as the deep fascia of the penis. It's the next layer of fascia that wraps all three of our tubes that make up the penile structure. And then most superficially, we're going to have the superficial fascia, also known as dartos fascia by clinicians. So that was a relatively brief overview of the male genitalia. We're now going to go through the female genitalia. Here we can see the external view as well as a more dissected view over here on the right. So let's start with the view that we would see on a patient over here on the left. If we, in this image, the clinician has pulled the labia minora and labia majora out laterally to really display the vestibule. The vestibule is the opening of the vagina down in this region. So what I want to point out here is more superiorly, we have this layer of skin that's overlying the clitoris. This is going to be the prepuce, it's the same name as in the male structure. The clitoris is the equivalent of the male penis, located right in this region. And as we go more inferiorly, we are then going to see the urethral opening. So the urethral opening is located between the glans clitoris and the vaginal opening more posteriorly. So the urethra does not pass through the vaginal canal, passes anterior to the vaginal canal, and it does not pass through the clitoris. This is a common mistake or misconception that you have to correct in clinic on occasion. So then here goes our vaginal opening down here, and again we said this entire region was the vestibule. And then we can vaguely see our labia minora here. That's going to be our inferior folds. Then labia majora are going to be more laterally. The labia majora come together at the more anterior portion of the pelvis, and this is going to be your mons pubis up in this region. Now over here on the right, we have a dissected female genital structure, and you can see just like in the males, they're going to have a crus, which is coming from laterally, and this is going to be cavernous tissue. So the crus comes out laterally, comes up. This looks just like the penile structure, except it's just a little bit smaller. And then what we have here, we had a bulb of the penis. We also have these greater vestibular bulbs in the female. So you can see those right here. And so this is going to be spongy tissue. As you can see, the urethral opening passing anterior to the vaginal canal opening. Now what I do want to point out is on the bottom of these vestibular bulbs, you're going to have the greater vestibular glands, also known as Bartholin glands. So they sit on the inferior borders, or the inferior posterior borders of your vestibular bulbs. Right. And I'll point out, we'll see the homologs in just a second, but the greater vestibular bulbs or glands are going to be the equivalent of the bulbourethral glands in males. So we mentioned homologous structures. So homologous structures are structures that are derived from the same embryonic origin. What I want to point out is that you will definitely need to make these comparisons. What is the structure in the males that corresponds to the same structure in the females? So the gonads is step number 1, so the testes in the male and the ovaries in the female. The epididymis, ductus deferens, seminal gland, and ejaculatory duct don't have a direct female comparison because they derive from different embryonic structures that degrade in the female. The appendix of the testes, the seminal colliculus, and prostatic utricle are going to be the equivalent of the uterine tube, the uterus, cervix, and superior vagina. I know for the med course that you'll have much more in-depth embryo, but this is just a good table to summarize. The prostate is going to be the equivalent of the periurethral glands. This is one that I like to point out. You know in the males that there is a region of the urethra that is called the prostatic urethra. And that's because the prostate wraps around the urethra in this region. Well, periurethral around the urethra. So that's how I keep those together. The prostate gland and periurethral glands are homologs because they both pass around the urethra. Next, we have the bulbourethral glands and the greater vestibular glands. If you remember, the greater vestibular glands were in association with the inferior posterior aspect of the vestibular bulbs, right? So vestibular bulbs and then bulbourethral glands. Something that often confuses people is they make the comparison between periurethral and bulbourethral as homologs because they both have the urethral ending. But I want to make it clear that these are not homologs with one another. Prostate and periurethral glands, bulbourethral glands, and greater vestibular glands are your homologs. The rest kind of makes sense when you think about the external structures of the genitals. The penis and the clitoris are homologs, the scrotum and the labia majora, and then the labia minora is a homolog to the penile raphe, which is the anterior portion along the ventrum of the penis. Now, that's an overview of the external genital structures, but what I find that students often struggle with is the perineal pouches. This is how we break up the perineum into a superficial and a deep region. The superficial region is actually located more inferiorly, so it's important that we're saying superficial and deep. We are not saying superior and inferior. So superficial is what, if we're looking from the bottom and looking up, is the first thing we're going to see, whereas deep is, again, more deep to that superficial layer. But once again, we are not saying superior and inferior, we are saying superficial and deep. So the superficial layer is going to be bordered by our superficial perineal fascia, located down here in blue, and then it's going to extend up into our perineal fascia, our perineal membrane, which is located here in red, and this is going to demarcate the borders of our superficial perineal fascia, our superficial perineal pouch. It is important to note which structures run through the superficial perineal pouch. They're not all shown on this image, but we have them on this table over here. You have the crura of the penis and the clitoris. You have the ischiocavernosus, bulbospongiosis, the bulb of the penis, the vestibular bulbs, the greater vestibular glands, superficial transverse perineal muscles, and the perineal body. The deep perineal pouch is going to extend from that perineal membrane all the way up to the pelvic diaphragm, which consists of the levator ani and coccygeus muscle. And so that's going to go to this purple line up here. So everything in this region is going to be composed of the deep perineal pouch. The deep perineal pouch has the external urethral sphincter, the bulbourethral glands, the deep transverse perineal muscle in the males, and the dorsal neurovasculature of the penis and the clitoris. Okay, so keep in mind that we have a superficial perineal pouch and a deep perineal pouch. They do not communicate with one another directly because they are separated by the perineal membrane, and there are different structures that run through these two regions. You're almost guaranteed to get asked a question at some point about which one of the following structures is located in one of these regions. Now, going into a little bit more in-depth view of the structures in the superficial perineal pouch, this is a model that you will also be able to see in lab. I would get really familiar with it. I think this is really a high-yield image in terms of being tested in this region. We want to once again point out the borders of the superficial perineal pouch. If you're looking straight down on the pelvic anatomy or the perineal anatomy, the first thing that you would see was the skin. That is going to, and then deep to the skin is the superficial perineal fascia. That would form the inferior border of your superficial perineal pouch. Then as I go more anteriorly, we are then going to see this white membrane that you can see in the back of this image. That is the superior border of the superficial perineal pouch, and that is your perineal membrane. So the structure is located between the perineal membrane and the more inferior located superficial perineal fascia also known as Colles fascia, is going to make up the borders of your superficial perineal pouch. Now, obviously we're looking at a female structure here, so we're going to go through the structures that we would expect to see, but remember that the male structures are basically the same, just with different exaggerations of the penile structure. Okay, so let's start off with the musculature, and then we'll go into some other components on a later slide when we talk about the neurovasculature supply. So first, wrapping around the bulbs, right? Remember, if we think back to that image that showed the dissected clitoral structure, we have the vestibular bulbs that are on either side of the vestibule, and around that you're going to have bulbospongious muscle. So the way I remember this is bulb for around the bulbs, and is spongy tissue, so bulbospongiosis. And this is going to be the same in the males. There's going to be a muscle that wraps around the bulb of the penis, that is the bulbospongiosis muscle. Now, if we look a little bit more laterally, we are going to have our ischiocavernosus muscle over here. The way that I remember this is it arises from the ischium, and it is made of cavernous tissue. It overlies the crus, and the crus is made of cavernous tissue. So this is the ischiocavernosus muscle. So bulbospongiosis, located more medially, ischiocavernosus, located more laterally. Now, going back here, we're talking about the triangles, the urogenital triangle. Remember that posterior border we talked about was basically demarcated by an imaginary line going across, but we can see that in the anatomy using the superficial transverse perineal muscle that comes across. So that's the superficial transverse perineal muscle here, inserting onto the perineal body, which is a region of ligaments and fascia that muscles attach to in between the vaginal canal in the vestibule and the anus, located more posteriorly. Okay, I think that's all that I wanted to point out here. If we look more look more anteriorly, we're going to have the glans clitoris, and we again have the labia minora, the vaginal canal opening, and the external urethral opening. Now, something that I would highly recommend nailing down is the pathway of the pudendal nerve. The pudendal nerve is made up of spinal segments S2 through S4, and remember that it arises and passes on top of the piriformis muscle before passing posterior to the sacrospinous ligament. So that is going through the greater sciatic foramen underneath the piriformis muscle. It then wraps around and passes into the perineum by going through the lesser sciatic foramen. Okay, so it goes through the lesser sciatic foramen and passes along the pudendal canal, which is formed by the obturator internus muscle. And that is through the lesser sciatic foramen to enter the perineum. So if we follow that pathway along, we are now seeing the pudendal nerve entering into the perineum. And it's now going to give off some branches that we need to know. The first is it's going to give off branches, the inferior rectal or anal branches that are going to supply the skin of the anal region as well as the external anal sphincter. Now, as we come more distally, we're going to have the perineal nerve, which is going to pass superficially into the perineal region, so the superficial perineal pouch. And that particular nerve is going to give off a couple of other nerves, such as your posterior labial nerve. This is also going to be the posterior scrotal nerve in the male. You also have the deep and superficial perineal nerves that are being given off in this region. Now, I do want to point out there is a nerve, the dorsal nerve of the clitoris. It will also be the dorsal nerve of the penis in males that passes into the deep perineal region, so the deep perineal pouch, and that is going to supply the region of the clitoris and the penis in males. And one last point that I want to point out, there are no parasympathetic fibers that run within the pudendal nerve. Parasympathetic innervation to the perineal region must pass through a different pathway than along with the pudendal nerve. Okay, this is just an image that's highlighting the internal pudendal artery as opposed to the nerve. They follow pretty much an identical course, so you're going to have it enter into the perineum in the more posterior regions by following that pudendal canal. It is now going to give off an inferior rectal artery, become more distally, and again, this is the internal pudendal artery. it is going to give off a perineal artery, which is going to pass anteriorly in the superficial perineal pouch. That also has a posterior labial artery or posterior scrotal artery in males. And then here we can see this deep vessel. This is going to be the vessel that is going to run to the dorsum of the penis or the clitoris. So this is the deep artery of the clitoris in this image here, running in through the deep perineal pouch underneath the perineal membrane, which you can see has been cut away here, so we can see the vessel running to the dorsum of the clitoris. Now, lymphatic drainage is something that you definitely want to know. Lymphatic drainage comes up almost all the time. When we're thinking about the lymphatic drainage, listed over here is the components that you need for the course pack. This is just a helpful image so that way you can see where some of these lymph nodes are located. But in the superficial inguinal lymph nodes, which are located right in this region, specifically the horizontal group, are going to drain the perineum, except for the clitoris and glans penis, the inferior region of the vagina, and the inferior anal canal. So they're doing a lot of the perineal structures. The internal iliac nodes, which are located here, those are draining the regions of the glans penis and clitoris, which was not being done by the superficial inguinal lymph nodes. The proximal cavernous bodies, the deep perineal pouch, the membranous urethra, and the superior vagina. And then lastly, something that is always high-yield to know is because the gonads originate beside the aorta and they descend down, the lymphatic drainage to the gonads is still via the para-aortic nodes. This is a point that comes up over and over again because it ties in a little bit of embryo. Alright, we're going to finish this video up with a little bit of clinical anatomy. Starting off with circumcision. So the circumcision is just the removal of the prepuce in males, but I want to point out where the nerve block is occurring. So the nerve block for circumcision has to occur in a dorsal nerve of the penis on either side. And in order to do this, you need to know the structures that are on the dorsum of the penile structure, and that is going to give you the vein more medially, artery laterally, and then most lateral is going to be the nerves. So what you do when you're doing this is you feel for the vein, the artery, and then you're going to go lateral to those structures to make sure you're not puncturing any vasculature. Next, we want to talk about a spongy urethral rupture. A spongy urethral rupture is a rupture of the urethra anywhere along this course when it's in the corpus spongiosum. This can lead to an accumulation of urine in the superficial perineal pouch. As you can see that this space is continuous. But this space is also continuous up here with the lower region of the abdomen. So as urine starts to fill the scrotum, it can continue up deep to Colles fascia, also known as the superficial membranous fascia, up into the region of the lower abdominal wall. And lastly, we want to talk about a pudendal nerve block, specifically a transvaginal pudendal nerve block. So this can be done in the case of any kind of operation in the region of the perineum or during childbirth. But if you remember the pathway of the pudendal nerve, then you'll understand this perfectly. So remember that the pudendal nerve passes through the greater sciatic foramen, wrapping around the sacrospinous ligament, and then passes through the lesser sciatic foramen into the perineum. So if a clinician is to go through the vaginal canal and palpate the ischial spine, if they find the ischial spine and the ligament that is attached, that is going to be the sacrospinous ligament, they know the pudendal nerve must run within this region. So once you palpate the ischial spine, you go just medial to that, and you can inject your anesthetic agent in this region to anesthetize the pudendal nerve. Lastly, I'm just going to flip through these practice questions. We're not going to go through them. I'm going to pause for a second on each slide. So if you want to pause the video so that we can answer the question yourself before you see the answer, then that would be recommended.